Hi, it's Joanne. When it comes to histamine intolerance, having a really thorough understanding of gut health, in particular SIBO, small intestinal bacterial overgrowth, is essential for any practitioner working in the histamine space. For those of you listening who have SIBO or suspect you might have SIBO driving up your histamines, this is an episode you won't want to miss. It's packed full of useful information and clinical pearls of wisdom you'll be pressed to find anywhere else. Welcome to the Histamine Well Podcast, designed for practitioners and patients alike. This is your trusted source for insights on histamine intolerance, methylation, gut health, women's hormones, and much more. I'm Joanne Kennedy, your host, naturopath, author, and educator, passionate about breaking down complex science into clear, accessible knowledge. Whether you're a health professional or navigating your personal wellness journey, the Histamine Well podcast bridges the gap between cutting-edge research and practical understanding to empower you with the tools to thrive. Hi everyone, welcome back to the show. Today's episode is all about SIBO, small intestinal bacterial overgrowth, and how it drives up histamine in your body. When I was sitting down to prepare for this episode, it dawned on me that there's no better person to pull all of this information out of my head than my colleague Melanie Peers. So today we're doing something different, whereby Melanie is going to interview me on this really important topic. So hi Mel, thank you so much for your time today.
Thank you. Well, I'm just glad to be here. It's so great to get the opportunity to pull the huge amounts of knowledge out of your brain. You know, you've taught me so much about SIBO, so I think we should unleash you on the public so that they get the chance to learn everything that you know.
Thank you. Unleash me.
Yeah.
Yeah, thank you so much.
Okay, well, let's just jump straight in. So people have probably heard of SIBO or SIBO. They might hear it pronounced small intestinal bacterial overgrowth. Do you want to explain a little bit about what it is as opposed to, like, we get bacterial overgrowth in the large intestine? What does it mean to have overgrowth in the small intestine? Because it's not the same, is it?
No, it's not the same for many reasons. So I'll just explain what it is firstly. We have trillions of bacteria in our gut, okay? And lots in the small bowel, lots in the large bowel, way more in the large bowel, but still we're talking about trillions of numbers, so a lot. And they're normal. We're meant to have them. But what can happen is that they can grow in numbers that are too high. And when they become too high, they take FODMAP foods and resistant starch and convert those foods into gases, which is SIBO, the gas, right? The methane hydrogen gas that we test for. What can also happen is that you can get an overgrowth of bacteria that's not meant to be in the small bowel. It's meant to only be in the large bowel. And then that also will cause problems with the gases. So it's a disruption in the microbiome of our small intestine. Essentially, too much bacteria that is causing the fermentation of these carbohydrates into gas. And that's why there's so much flatulence and belching and bloating with SIBO. It's a classic symptom because it's creating gas.
That's right. And as you said, a lot of the time it's this what we call the healthy bacteria that are growing there. There's just too many of them and they're fermenting these wonderful fibers that are supposed to make us feel good, right? And a lot of people start to feel worse when they're eating them. So that's a great explanation. Thank you. And, we see a lot of SIBO in clinic. When people come in with histamine issues, what proportion of those people would you say have a problem with SIBO?
Huge proportion, Mel. I'd say up to 80%. And this is because there's many things that cause SIBO. You can't just think about SIBO as a simple bacterial overgrowth in the small intestine because it's an entire gut issue, because digestive enzyme insufficiency can cause it. Disrupted bile flow in particular from poor gallbladder function, poor liver, estrogen dominance, mold. Okay, so that can cause it. Chronic constipation from having gluten intolerance can cause it. Or you have massive issues in the large intestine can cause it. So when we're thinking about SIBO, we don't just say, oh, there's bad bacteria, let's just kill it off with some herbs or antibiotics. And the interesting thing about this is that all of these things that I've just mentioned that cause SIBO, they also drive up histamine in their own right. So this is why we see so much histamine, and with SIBO, it's getting a lot of traction, SIBO, which is great, more in mainstream allopathy as well. It's great. It's very, very common. So we see it a lot, and people, they'll come to me, they're like, I've definitely got SIBO, this is my problem, or they have had SIBO before and they've tried to treat it, they've treated it and been unsuccessful, they've treated it and it's come back, and they're just like really focused on just the SIBO. And like, if I get those SIBO numbers down, it's going to fix everything. But it's like, no, it's one part of the picture, an important part, but we don't just treat SIBO. And I must say, I do pride myself with my clinic and the girls that work for me that we're really not just focused on one thing. We really are really broad. So I always will refer my patients to Melanie that need help with mold, because mold is a major cause of SIBO, for instance.
Yeah,
right?
I think about 80% of people who are exposed to mold end up with SIBO, if not higher. I would even say the numbers in what I've seen is pretty much 100%.
Really?
Yeah.
Okay.
It's so disruptive. And that's the thing, I think we need to set the expectation that people come to us, as you said, fix my SIBO, fix my problem. SIBO is actually more of a symptom of these underlying problems, this gut dysfunction. Something is happening in the process. And I always say, it's like a conveyor belt in a factory. If something goes wrong at the beginning, what happens at the end is going to be disrupted, because everything has to happen in a certain order. So it can be anything from the stomach acid to the gallbladder to the pancreas releasing enzymes. There's all sorts of things that can go wrong, and it's the environment in the gut that is allowing this overgrowth, because
so true.
A healthy, robust gut keeps things in check, doesn't it?
Yeah, it totally does. And when I see patients and they'll have SIBO, and I'm like, yeah, for sure you've got SIBO. Like, it's so obvious. But what about what's going on with the mold, and what's going on with your organic acids test? You're full of oxalates, and you've got methylation disruption, and you've got high estrogen. And so this is where we're like, let's just pull this whole case together, the whole person picture. This is usually, Mel, isn't it, the people that have been tested for SIBO before, treated SIBO before, and they're resistant or it's come back. Yeah. But we see a lot of people like this.
Because they're not fixing the reason that it happened.
That's exactly right. That's exactly right. And they are so full of histamine, and that's how they find us. Because we're the histamine gurus. Because it's just so common, because it actually, all the things that Mel and I specialize in, are absolutely going to drive up histamine. Yeah.
Because in a perfect world, someone would come to us with SIBO or histamine issues. It's just SIBO, and we fix that and they go on their way. How many people would you say, well, what percentage come in and the histamine is only driven by SIBO and not other factors?
Only 20%.
Yeah, it's a multifactorial issue, isn't it, the histamine? Yeah,
and some people with SIBO don't have histamine issues, and I'm sometimes like, oh my God, like I go through all the symptoms. Do you get reflux? Do you get heartburn? Do you get headaches, migraines? How's your skin? And they don't. It baffles me. I'm just sitting there going, how are you not a bucket of histamine? Some people, they're just not. And the more I work with this, Mel, it's because they just have SIBO. They're the people that are like, you've got SIBO, let's get the treatment going, the protocol in, the bowels moving, the digestive enzymes in. And these are the people that they follow suit. It's a very, very simple process. It's not hard. It's quite difficult for them because of the boring diet, but you get the FODMAP foods and the resistant starch out of the diet, make sure the motility is working, the bowels are moving, the digestive enzymes are in, the right herbs, and it just will start to clear. And it does it beautifully. Do it in 3 to 4 months. I love my SIBO protocol. It's great. Simple.
And beyond that, though, you always send them away with, this is how we prevent reoccurrence, right?
Because absolutely.
That's a really big part of it.
Yeah, absolutely. A lot of my SIBO patients work with Nicole, who's my nutritionist, who is really good at coaching people through how to prevent the recurrence. But there's more simple cases. So that can happen. Absolutely. When they're a bucket of histamine, that's just like in the back of my mind going, let's really dive deep on this case to really work out that the SIBO is not just coming from some acute food poisoning or stress, or maybe they just had a really poor diet for a while. That will do it. Can't tell you how many people post-COVID had SIBO because they're just sitting at home ordering in takeaway, just working at their computer. I understand.
And the over-sanitization of the hands.
Yeah.
Lots of hand sanitizer.
Yeah. And people working at their computer all day, and they're eating at their computer. And I understand, like, you kind of people got addicted just to working at their computer all day, and because it's just that dopamine hit. And then there's calling in Uber Eats and eating hydrogenated vegetable oils and terrible food. I can't tell you how many patients I had with SIBO from that.
And even I talk to clients a lot about digestion beginning in the brain. If you've got Uber Eats, you're on your computer, you're working away, maybe a bit stressed, the food arrives immediately, you're eating, the brain has not had time to realize that food's coming to prepare digestion.
It's really simple, Mel, isn't it? There's no smelling of the cooking, there's no smelling the garlic, there's no smelling the meat you're going to cook or anything.
Yeah,
it's really
not
interesting.
Hours of this aromas stimulating digestion.
Yeah, it's really true. You kind of think, oh, yeah, I get it. But it's like, no, it's a really big deal.
So like something as simple as literally like just sniffing your food before you eat it is part of what I use with my clients when we're dealing with that. So we have our people who have got SIBO with high histamine symptoms. What is driving the histamine for these people?
Yeah, well, simply with SIBO, the bacteria that's converting those FODMAP foods and resistant starch into gases the gases are driving up inflammation. So that's that one part. Now we know that when there's inflammation in the body, histamine is released. This is normal. It's a normal part of the immune response. There's cells in the gut, smooth muscle cells, mast cells, they're going to release histamine. And then the DAO enzyme that breaks down histamine is actually highly concentrated in the small bowel. There's a lot of DAO in the small bowel, mainly because it's where you digest your food.
Mm-hmm.
It can simply get overloaded with too much histamine because there's just so much. Or we also see cases whereby there's a reduction in the synthesis and excretion of DAO, right? So the net result will be, again, too much histamine. But with the DAO enzyme, I've seen a lot of tests. Most people don't have a test result that comes back low. And people argue with me that it's not a problem. It's like, yes, you're producing DAO at the range the lab thinks is adequate, but they don't know how much histamine you've got. It's overloaded with histamine. Simply the enzyme is overloaded. Now, as I was saying in the beginning, SIBO is not just a matter of this bacterial overgrowth. So what can also happen in SIBO is that when you have an acidic environment in your small intestine, which is basically a breeding ground for SIBO, and there's many reasons for that, one being digestive enzyme insufficiency and pancreatic juice insufficiency. So you need pancreatic juice to alkalize the small intestine, and that allows your pancreatic enzymes to work effectively. So if you simply can't break down your food, so pancreatic enzymes do break down carbohydrates and starch and fats and protein. They do everything. Your food's going to sit, rot, and ferment in your gut, increase histamine. And then we also need to understand that with SIBO, the low hydrochloric acid is a major cause of SIBO. So hydrochloric acid breaks down animal protein and it will disrupt. So it's acidic hydrochloric acid, it's meant to be. And when you eat food, once you're eating that food, let's say a steak, it sends a message to the gallbladder to take bile acids into the small intestine. Okay, and it's going to break down your fat. It sends a message to the pancreas to take pancreatic juice into the small bowel. That allows the pancreatic enzymes to function. And so when that entire system is not working, you're not breaking down your food properly, and it will cause a histamine reaction because the foods are sitting there and not moving.
The immune system's freaking out, right?
The immune system does not know what this carrot is. It does not know what this piece of meat is. It doesn't understand. Okay, and this is where we can have a big conversation about nervous system. We won't, but this is, the nervous system causing a reduction in hydrochloric acid and then causing issues with the whole orchestra of digestive enzymes.
It's that factory, isn't it? The process prior has to work properly for the next process, and those digestive enzymes and that bile, that's what creates that alkaline environment because we're not supposed to have acid. Acid from the stomach is supposed to stimulate these things to try and alkalize.
Yeah.
And so if that stimulation doesn't happen, the digestion doesn't happen properly, we have food sitting there for too long, the immune system starts going, hold on, because by the time it gets to the immune system, it's supposed to be broken down and absorbed. The immune system's going, whoa, this is not supposed to be here. I'm very confused.
Yeah, it's
Send
as
out
simple as
histamine.
that.
That's the answer, histamine.
Yeah, just guys, the gut is a big immune system. I think that's what we need to say to people. And it's very governed by the nervous system. Yeah, so then there we go. We've got more histamine there. And then what else happens? Well, if you've got a lot of methane, SIBO, that will slow down the motility of the bowel. And then you have chronic constipation. You're not pooping out your food, you're undigested food, you're not pooping out the bad bacteria. You're going to be getting building up of estrogen and toxins in your gut. That is going to drive up histamine as well. So funnily enough, some people you really think, oh, they've definitely got SIBO, but they have digestive enzyme insufficiency and chronic constipation. And they just don't have the bacteria somehow hasn't overgrown to a point where you need to treat that, but the symptoms are exactly the same.
And the underlying drivers are the same,
Yeah. So it's like they're the top part of let's just say digestive enzymes at the top, small bowel in the middle, large bowel in the bottom. If your top and bottom's not working, okay, there's just going to be this sort of like the environment in the small bowel is going to be disrupted. And the bacteria might not have grown to a point where it's high enough for the test to test it. I'm sure one day it will. So some people say, oh, I absolutely don't have SIBO. But in my mind, I'm like, yeah, you don't have SIBO, but your small intestine's just inflamed.
You just don't have it yet.
Yeah, and you don't have it yet. Yeah. But it's just like, okay, you might not need to do the low FODMAP diet, which is lucky for them. They don't need herbs to kill off the SIBO, but they need to get digestive enzymes in. They need to alkalize the small intestine, and they need to get the bowels moving. And then that's a whole top to tail. It's a tube. It's going to start working. Yeah. And SIBO is it's an entire gut problem.
Yeah. What do you think about people like to talk, especially with taking probiotics, but I also hear about people talking about within the gut about histamine producers versus histamine degraders. Do you find an imbalance in those in the gut can be problematic for histamine, or is it really quite mild?
The food smell?
The bacteria. So we've got the histamine producing bacteria, the histamine degrading bacteria. Oh. Do you find that is a really big factor?
Not at all.
No.
Not at all. And I talk about this. This is 12 years of experience with this. I actually spoke about this on episode 2, main causes of high histamine. So when I first started treating histamine years ago, we were just putting people on a low histamine diet, possibly giving them some digestive enzymes, doing a stool test, and then looking at the stool test and saying, oh, wow, you have dysbiosis, an overgrowth of bad bacteria, an undergrowth of good bacteria. Thereby, a lot of those bacteria are histamine producers, and a lot of those good bacteria that are low, they can degrade histamine. And doesn't this sound like something that you just absolutely focus on? You're like, this is, wow. What we're going to do is we're going to kill off those histamine-producing bacteria, and we're going to increase those good bacteria that support the breaking down of histamine and immune function, and then you will get better. But I'm here to tell you that that doesn't happen.
Yeah.
It's not that. It's not that. It's something else. I see so many people who have done these elaborate stool tests, and they're just focusing and really trying to just correct that dysbiosis in the large intestine, and it just does not correlate with a great clinical outcome for histamine. I'm just saying, for histamine. It is either coming from oxalates or mold or digestive enzyme insufficiency or gluten intolerance or things like high calprotectin, Crohn's or ulcerative colitis, or SIBO. Mm-hmm. It's just not that dysbiotic bacteria in the large intestine that's driving up the histamine symptoms.
Which I think, because there's just so much information out there, and I think our clients that come in to see us are actually very well researched, and they know a lot because they've had to really research and find out what histamine is to be able to discover what their problem is. But unfortunately, I think, as you said, they hone in on these small things, which is why it's so important when you've done all the research, come to a practitioner, because we need to look at the big picture. Because if you hone in on, the degraders versus the producers, you're going to maybe miss the pancreatic enzyme insufficiency or mold or other factors. So
it's really true, Mel. I just
so
want to
much
talk
more.
about, I just want to dive deeper into this. So when it comes to neurological histamine symptoms like migraines and headaches, anxiety and insomnia, there is a lot of research on gut-brain axis, and the inflammation in the gut can drive up histamine, get into the brain, increase histamine in the brain. And certainly people with SIBO having some headaches and things like that can attest to, for sure. I know that when I eat high histamine foods, I get dizzy, I get a headache.
Mm-hmm.
But the more I work with this, the more I'm having to think three things. Firstly, is there mold? Is there marcons? Do you have mold in your nose and bad bacteria in your nose driving up histamine in the brain? Is it estrogen, or is it a big methylation problem? The thing with methylation is it breaks down histamine in the brain. Our brains do have histamine, and we make histamine in the brain. So when people are getting that high histamine in the brain and they've gone down the rabbit hole of SIBO and oxalates and large bowel dysbiosis and they're getting no resolution, I'm honing in on mold. I'm definitely thinking about sinus issues and marcons. And then I'm now getting them to do at-home methylation tests that we can now do. So it's like a COVID test. It's a saliva swab test. So you can now test your methylation at home in real time. And the interesting thing about this, Mel, is that a lot of people are actually over-methylating. And the more I'm seeing this is people are over-methylated, whereby it's not what it sounds, over-methylating. It's like they've got a cache of methyls that aren't necessarily being utilized. Does that make sense?
Yeah.
Right? So there's a transport truck and no driver. And so I had a patient recently with like insane insomnia, and he's an endurance athlete. And I'm like, it's a problem. He's like, no, but it comes and goes. Like he's had it for 10 years and it comes and goes with moving different environments and no real pattern. Still an endurance athlete this whole time. And we went through all of his testing, and he's done so much work on his gut and cortisol, and he's even gone down the mold route. And I said to him, you need to do this methylation test, because there is no doubt that your methylation is disrupted because of, the insomnia, chicken and egg. Well, if you've got chronic insomnia, it's going to cause chronic inflammation and chronic stress and methylation disruption. And so with him, and he had so many questions to ask me, and it's like, no, like we don't just need to focus on the gut stuff when you've got all this neurological histamine going on, because the DAO enzyme is absent in the central nervous system. It is histamine.
It's not going to touch the sides.
Yeah. It's histamine and it's methylation. When it's neurological, we really need to think about that. So interesting, guys. So guys, you can test methylation at home. It's called Somaticode Mood Sense Testing. I've actually secured listeners 10% off discount for this test. It's amazing. I'm using it all the time, Mel. I'm going to talk to you about it soon.
Yeah, you need to tell me more about it. We actually have a mutual client. I'm seeing the child and you're seeing the mum, and she's like, Joe's got me on this methylation test and I'm over methylating, and I thought, I've got to know more about this.
Yeah. So a lot of people are over methylating. So so sorry, we've just gone off SIBO, but it's another big contributing factor to histamine symptoms is methylation. Also, what I've seen is that I've had patients whereby they've done a Dutch hormones test and they have very low methylation of their estrogen, very low.
Right.
And they do this methylation at home test kit, and every single day, Mel, they're over methylating. Where are these methyl groups going? They're not going to estrogen. So very fascinating stuff. It's just a game. It's such an amazing test, and you can test it in real time, because methylation it changes. It changes with sleep, diet, exercise. It changes with hormones, amongst other things.
Any blood test, it's a snapshot at a moment in time, isn't it? And there are
Yeah.
very many variables. But methylation is another thing that people kind of can get a little bit hooked on, isn't it? That they come in, it's my methylation, I feel so terrible, and then we realize actually no, it's the mold. It's because people attune methylation with detoxification as well.
Totally. Yep.
And we know mold and other environmental toxins, but mold being a really big one is a really big driver. And as you said, we see it so often in SIBO.
Yeah, I'm glad you've brought that up. Not everyone, I'm not getting everyone to do this test. It's when the cases are, when they've done a lot of the other work and there's still things left. I mean, with this guy with the insomnia, like if he hadn't done every test under the sun already, Mel, and had gone down with reputable physicians and people I know in the US who are really good with histamine, if he hadn't done that, I'm not saying I'd hone in on methylation straight away, but it was just he had SIBO, fixed it. He was out of the mold. He had no other mold symptoms. He didn't have high oxalate. He didn't have gluten intolerance. And there was no change with whether he ate histamine foods or not. The one thing that helped him, the only sleeping aid he could take, and I'm talking he took temazepam and things like that, couldn't sleep, was an antihistamine. So when with this case, I'm like, I'm not going to get you to do another stool test. I'm not going to because I sound like the mold whisperer. I just don't let people pass. I'm like, no, you passed the mold with me. Let's just get this methylation testing done. He's an endurance athlete. It just depletes your methyls. And I know and he said it's making no change, no difference to my sleep, whether I do or don't. I'm like, yeah, but let's just see what your methylation is when you do a 20K run. Maybe it is a problem.
Yeah.
Anyway, it's just super exciting.
I think it's good. I know as I said, we've gone a little bit off topic, but I think the most important thing to realize is there isn't one thing. So when you come to us, we go for the most obvious thing first, but sometimes it's not the most obvious. And then we go to the next thing. There's always a next step that we can look at. Depends on how many layers of your onion there are.
Yeah.
Right?
Yeah, no, it's layers. It's layers of onion. So
the hardest thing about what we do is not necessarily knowing what to do for somebody. Oh, what do I do to fix that? I've got so many different options. Which one is the most likely to fix this person? Because there's so many different underlying reasons for insomnia and gut issues and things like that. So, always keep diving and digging in because there's always going to be an answer.
Yeah, I totally agree. And with the histamine patients, I say to them, there is about 15 causes of high histamine. And if it's irritable bowel disease, that's been covered by allopathy. We can help with that, or it's celiac, but the other things is we have the testing we can do. We have the organic acids testing and complete microbiome mapping. I find quite interesting now to look at those sulfur producing bacteria and the low oxalobacter and high calprotectin, which is very linked to mold, things like that. Or we've got SIBO testing. So we've got all this functional medicine testing that we can use to really pinpoint where the big histamine issues are coming from. And not to mention homocysteine test. And now the methylation testing. So we've got some really good resources that we can use to really pinpoint where it's coming from.
So speaking of testing, how do you test for SIBO?
Oh, good question. SIBO is a breath test. And usually you can do a test from home. The lab will post you the test kit. So you do it from home and you take a substrate. Now, lactulose is the substrate that is most useful because it works on most of the the small bowel, and picks up the majority of the bacteria. Glucose can be used in conjunction with lactulose as it works more on the lower part of the small intestine and it can pick up some other different bacteria. However, you can't just do glucose on its own. It just is not enough. So be very careful. There's now labs in the US where you order it. They used to send you lactulose, but now you have to have an appointment with a doctor there to get prescription for lactulose. Anyway, I won't say the lab, but just be careful. I know. Anyway, this is in America. So be careful, you guys in the US, just make sure, I'll just tell you, you can get it from directlabs.com. I'll put that in the show notes. You can order the 3-hour SIBO lactulose test from Direct Labs and do it from home. It's a simple breath test. Yeah.
Yeah, it's quite easy to do. And what about, like, is there any evidence that you can spot in any other testing, like a stool test, that might indicate SIBO, or is it have to be the breath test?
I don't think you can 100% extrapolate a stool test result to say that you've got SIBO.
Mm.
I just don't.
Yeah. They're two different environments, aren't they?
It's different environments. And look, I did a whole episode with Bridget Greenall, who is a girl that trained in my histamine methylation course. She's so lovely. She did a whole case with me. It's coming up on one of our episodes. The whole episode is about what do we do with patients we suspect have SIBO and can't test. I've got patients in Libya at the moment and Palestine, places like this, and they can't test. So what do? We have a really good session with them and go through the case history. What are their risk factors for SIBO? Like, do they have a lot of them? What are their signs and symptoms? Just ruling it out. And the thing with SIBO, it does become quite obvious that it's a problem. And then just doing the SIBO diet, that low FODMAP, low resistance starch diet, and making sure motility is moving, okay? Just making sure they're clearing out the bacteria and undigested food so their bowels are moving. If you do that for a couple of weeks and their symptoms significantly improve, in my mind, it's like, let's just hone in on SIBO. Yes, what caused it and all the other fringe things around, we need to think about that. But if you can't test, it is the one thing that we can treat. I do it for 3 to 4 months. But with regards to the bacteria, Mel, it's the great thing with SIBO is if it's methane SIBO, allicin and oregano are very specific herbs for methane. If it's hydrogen, berberine is very specific for hydrogen, and oregano also works as well. So there's 3 herbs. So you can, and they're safe, right? So you can do the diet and some herbs, make sure my bowels are moving. If they need some digestive enzymes, that would be great. And you can work with them and then after 3 or 4 months, reintroduce the foods and see if they flare. And usually they don't. So if you've worked with that patient well and seen them every couple of weeks, especially at the beginning, to make sure they're on track, and they have to be compliant with the diet, they really do. And then you reintroduce foods and they don't flare at all. And if there's a histamine picture, you do a SIBO low histamine diet.
That's what I was about to ask you. Do you combine them? Yeah.
Yeah. SIBO low histamine diet. And then you reintroduce the FODMAPs and resistant starch, make sure they're okay. And then you reintroduce histamine. And I've done this a lot. I did this a lot before I used to do a lot of testing. I like testing when I can, because it's just, I think people like the evidence as well. But you can do that with SIBO if you can't test. Yeah.
Okay.
Another thing I get worried, you know what the other thing? Some people's SIBO is so high and causing such havoc with histamine, they're almost having anaphylactic reactions. That lactulose substrate, if I'm a bit concerned someone's going to actually be anaphylactic almost, I don't mean full-blown anaphylaxis, but breakout in hives in their throat can start
more allergy type
swell.
Yeah.
I'm like, you're not going to do well in that lactulose. Let's just treat it without testing. Yeah.
It can be a killer for some people. Some people do come in and they say, I've already done one and it was hell.
That's classic. I'm like, well, you have, like, if you took lactulose and you really had such a massive adverse reaction, that's enough evidence to me that you've got SIBO.
Yeah, because it's a decent dose.
Before we go any further, I want to speak directly to the practitioners and students listening. If you're intrigued by histamine and methylation and eager to expand your knowledge in this fascinating area, we offer the Histamine and Methylation online group coaching course, the only program of its kind. It covers everything you need to know about histamine and methylation, providing both the theory and guidance you need to treat these issues effectively in clinical practice. We cover SIBO, hormonal imbalances, oxalates, MTHFR, the 4 pathways of methylation, including the folate pathway, methionine pathway, tetrahydrobiopterin pathway, and the all-important transsulfuration pathway, and much more. The program is delivered by detailed online webinars and handouts for you to keep. And for 8 weeks, you'll meet with me for live coaching calls in a private community space with other practitioners from all over the world dealing with histamine and methylation issues in their patients every day. Together, we learn so much. To learn more and apply, visit joannekennedyneuropathy.com.
Let's talk about, I guess, one of the reasons that I came in to work with you, the outliers who do the low FODMAP low histamine diet, and they don't feel any better or they feel worse.
Mm-hmm. Okay.
That's when we really start to suspect oxalates and histamine, right?
Absolutely. So practitioners especially. So if you put your patient on, say, SIBO low histamine diet, and they come back 2 weeks later, and if their histamines have calmed down, and they're still just really bloated, and they're eating, it's such a healthy diet, right? No gluten, no chocolate cake, no fun.
Mm-hmm.
The bowels are moving, got the digestive enzymes in, and they're just so bloated. That is a massive red flag for migrating motor complex problem. So the migrating motor complex is an electrical impulse that starts 90 minutes after you eat, and it sweeps out undigested food and bad bacteria. So it can happen with SIBO. So if that's happening and you're still really bloated, then that's a red flag that you need prokinetic, and I say prokinetic medication, not natural. The prokinetic medications are way more efficacious, like that low dose naltrexone. You need to kickstart that migrating motor complex because it's not moving. The bacteria is sitting there dying off or being killed off from the herbs, and it's not moving. This is also a red flag. People are having Herx reactions. That can happen. The other thing that can happen is the SIBO low histamine diet is not low oxalate at all.
It's not. It's actually a bit hot. Some people can really increase.
Yes.
Their
So what people do is they can't have grains, so they're going to go almond meal crazy. And also, nuts are yummy when you can't have your little chocolate frog in the afternoon. So you go crazy on nuts. And we can't have lactose, so you get into almond milk. All super high oxalate. And if people are coming back and they have a worsening of their histamine symptoms or they're getting joint pain, Mel, tell me what else. What happened to you?
Well, so for me, it was very much, headaches, muscle tightness, joint pain, fatigue. I just felt awful. Brain fog. I couldn't think. It was just, horrendous. And it was the high oxalates that was doing it. And the other thing I would say is for mold is you go low histamine. I always say it kind of like takes the edge off, but it doesn't really resolve your symptoms. So if you're just doing low histamine and you go, I do feel a little bit better when I'm low histamine, I'm not flaring as badly, or my flares don't go for as long, but you're still flaring, that's a red flag for mold for me, because that's what happened to me.
Wow.
And for those that don't know, the reason I started working with Jo is because I came to her while I was still studying, and I was that person that did not get better.
Yeah, no, you didn't.
I got worse. And then you identified the oxalates, found the mold, and here we are all these years later.
Yeah, that's how it go. That's how it went. So I was fortunate enough that Melanie came to work with me, and then I sat in on consults. This is what happened, guys. This is what happened, right? I'm like, Melanie, you need to sit on cases with me to learn about SIBO and methylation and hormones. First case, I'll never forget it. It was that gorgeous guy in Scotland, that sweetheart, coming to see me, and Mel sat in, and he was a bucket of mold. Was he oxalate as well?
Huge oxalates. He was eating a bag of spinach every day.
Yeah.
And I'm so glad that it happened to be that we were both in there, because you go to me, Mel, this is oxalate. And I'm like, this is mold. And we were both right.
Yeah.
Because it was a mold. Because they go so hand in hand. And he was so unwell.
He was so sick. It was so sick. So sick.
Everything to get better. And the healthier and healthier he ate, the worse and worse he got. And as I said, he was eating a bag of spinach every day because it was healthy. And the poor thing. And
So what started happening? This is just the crazy universe interjecting. He happened, and then every patient for like a month was mold for me.
Yeah.
Every time Mel sat in with me, she's like teaching me.
Yeah.
I'm like, come
It
in
was
and
funny.
I'll learn from me. And she's just teaching me. And that was brilliant because as soon as that happened, like I just no one gets past me with mold now. It's just I
Yeah.
can see it so
You
clearly.
can't unsee it, right? It's just, it
Can't
becomes more
unsee
and
it.
more obvious every time. But that's one of the biggest red flags. You know, if you're listening to this, you know about histamine. You've probably gone on a low histamine diet. If you're not feeling quite a bit of resolution in your symptoms, then there's something else driving the histamine beyond the food and the gut, whether it's methylation or environmental, such as mold, driving the histamine right up.
Totally. Can we just now talk about that extra layer of the onion that was unraveled in you a few years after this oxalate mold issue, being the big sulfur problem that reared its ugly head?
Yeah, oh my goodness, because, there wasn't enough layers of my onion. We had to go and find another one, which was, sulfur became a problem. So, interestingly enough, looking back now, coming out of the mold was a big improvement with the histamine, but the oxalate and the sulfur were really kind of mimicking histamine symptoms. And what I now find clinically is anyone who's got a sulfur or an oxalate issue, quite often they do still have a bit of a histamine issue, but that's not actually the main driver.
Mm-hmm. Yeah.
It's not the histamine foods, it's the oxalates raising histamine or the sulfur making them feel very gassed out. So the sulfur became a problem because with oxalate basically makes your body waste sulfur. It pushes it out of the cell into the bloodstream. It doesn't belong on its own in the bloodstream as a sulfur molecule, so your body will just waste it into the urine. So you become very sulfur deficient, and then you can't, the catch-22 being then you can't tolerate sulfur foods very well because the body tends to compensate by overproducing bacteria that produce sulfur in the gut. That's a kind of a backup measure to get more sulfur. But of course, you eat the sulfur foods and those bacteria are releasing all the sulfur and you're feeling terrible because it's sulfite that they release instead of sulfate. So you can end up feeling, but they all kind of mimic each other. So again, that would be in the next step that I would look to is if low histamine diets, taking the edge off but not resolving, oxalate and sulfur could be actually the major problem. And very rarely I see that histamine is not a problem at all, but generally it's much less of a problem than we initially think when we
When you
identify oxalate and sulfur.
going back when you see someone with hydrogen sulfide SIBO or a large bowel test where they've got lots of those sulfur producing bacteria, do you just stop and think, oh, this is way more than just some sulfur producing bacteria?
Yeah, there's a reason why it's happening, right?
Yeah.
So
These sulfur these sulfofibrio-nibrios, I think that's what they're called.
it's funny, isn't it? You read about all these bacteria and you never hear them pronounced out loud. So
Yeah, I'd often just
figure
say
out
I
how to
can't
pronounce them.
Disulfofibrios,
Yeah.
class of sulfur bacteria. When they're normal to the gut and they're upregulated. Why? When I see that in a large bowel stool test, I'm like, oh, why?
Yeah.
Oxalates, mold, low homocysteine level. If you've got low homocysteine as well, it's like big sulfur problem.
Yeah, and hydrogen sulfide SIBO is a type of SIBO as well. Unfortunately, we just can't test for it. I think they are bringing out tests in the States. We don't have anything here in Australia yet. But that's pretty obvious. You pull sulfur out of the diet, you feel a load better.
Yeah, it's easy to diagnose that from the dietary change. Oh, the other thing, so what can also happen when people go on a SIBO diet is it's the absolute opposite to a hydrogen sulfide diet.
Yes.
It's the opposite. It's like a complete opposite. Okay.
More meat. People tend to eat a lot of meat.
So Mel, can you just tell listeners, like if they've done that, tell them the sulfur symptoms that they could potentially be having from going on a low FODMAP diet, a SIBO diet, and how if they're eating way more sulfur, and that they actually do have hydrogen sulfide SIBO, it just hasn't been detected. What are some red flag symptoms?
Okay, the number one symptom I would say, and this is a term that I've coined by my own experience, and all of my clients tend to agree, you feel gassed out. It's kind of the only way, hungover, just not just brain fog, you just feel toxic and really unwell. You might get reflux, bloating, swelling can be quite common, so fluid retention. But the main symptom would be like nausea, hungover, gassed out, toxic
Okay.
feeling. And it's not just fatigue, it is debilitating fatigue.
Okay.
That builds up over several days. So you might be okay, but once you've been on sulfur foods for about a week, you might find you can barely get out of bed. You shortness of breath, you get out of breath doing the smallest things. It's body fatigue, it's brain fatigue, it's just all encompassing fatigue. It's I wouldn't wish it on anybody. It's terrible.
Mel, do you know why sulfur is causing that big issue with fatigue?
So it's just because the sulfur that the gut is, the bacteria are producing is sulfite, which is toxic to the brain.
Yeah. It's like having it's like drinking some heavy Barossa Australian red wines.
Yeah. So yeah.
Okay. I understand.
So,
I understand that feel. I understand that feeling.
It belongs in the body, but not in the numbers that is being produced when you're having those foods. And so, yeah, if you see low homocysteine, anything below 6, 6 to 7 is, you really want to see it at about 7 optimal. So at 6, I wouldn't be worrying, but you start to see like 5 and 4, then you start to think, okay, the body is deplete in sulfur. You can't tolerate sulfur supplements like glutathione or NAC. They make you feel sick or make you feel worse.
Yeah.
And it's unfortunately that the body's recycling all this cysteine from homocysteine to create more sulfur in the body because you're so deplete. But at the same time, this bacteria is making you feel terrible.
Yeah, good one.
We've kind of talked about being resistant to treatment, but what would cause people to relapse with their SIBO?
Just stress is a massive relapse. Her lovely girl once, American girl, she lived in Hollywood, right? She worked in that film industry, hectic, did fly to New York and back again and on set all day and stressful environment. And she just had SIBO and she just didn't change her job. It's hard. It's like her career. And she could never get on top of it because of the amount of stress that she had. I just need to flag that. Another thing is that if mold is present and hasn't been addressed, your SIBO is just going to keep coming back. And if you have issues with migrating motor complex, it's funny, the migrating motor complex, it's like there is a test in the US that you can test to see if you've got antibodies that can disrupt the migrating motor complex.
Oh, interesting.
However, that's all well and good. I don't think we can get it tested. I think there was some laboratories in Australia trying to work with them in the US, but I think because of COVID, the disrupted post, you couldn't get the test there in time. I just think they dropped it. But there's a way I always think about migrating motor complex as well is, as I said before, is if you just do that SIBO diet and come back, as long as your bowels are moving and you're just still crazy bloated, that's just a red flag. I think, and I've seen this clinically, people that graze all day long. I had a girl, she just ate rice crackers and tuna and cottage cheese, just grazed all day for hours. 4 hours, she just grazed. She's just that her migrating motor complex is not functioning.
Not activated. Doesn't get activated.
It's not activating. And then, it's going to become lazy. I had several patients like that. The snackers, the grazers.
Oh, and then this idea of, eat six meals a day. I always say to my clients, we're not cows. We're not designed to graze.
No.
3 meals a day. And the only exception to that would be if someone's got a lot of adrenal dysregulation and blood glucose dysregulation, we do need to snack more often. But as soon as we can, we get them onto 3 meals a day. We are not cows. We're not designed to graze. We need to activate that migrating motor complex as frequently as we can. It's a nice little cleaning system that sweeps through the intestines to clear them out and get rid of all that debris that could be triggering
totally
SIBO.
Totally. So that's a thing we see clinically. Guys, I just want to give you some like real world, like what's going on in the real world with patients that we see. Okay. That, do you know what else? So going gluten-free and just going full-blown gluten-free products full of rice. Rice is a disaster for SIBO. It's got mold and mold mycotoxins in it. Or just going really heavy on legumes, like just eating like a tub of hummus a day, eating lots of that paleo pasta. I have just seen, it's like that you got to always remember that SIBO bacteria is normal. If you just start feeding it, the thing with legumes, they're high in resistant starch and in FODMAPs. They're double whammy. And then you just start eating a lot of that. Then it has a potential just to come back. Well, you're just going to be providing this bacteria with a lot of the food that it just really thrives on. Just red flag for that. And then people, they're completely and utterly gluten intolerant. And I get it. How good is gluten? But they're completely gluten intolerant. And in particular, it just stops their bowels. They'll have pasta and then they're constipated for 5 days. Right?
And a side note to gluten intolerance, if you don't break down gluten properly, they create these opioid compounds. It binds to the opioid receptors. It feels so good. You get this really good response.
Yeah, it does. Yeah.
Because you're
that's
not
why
breaking it down properly.
It's so addictive.
Yeah.
So I had a lovely patient of mine, gorgeous girl. She's such a sweetheart. And we got rid of her SIBO. She did it so well. We cleared it out. We retested it. It went. And then she just decided, and she was completely gluten intolerant as well. She got some supplement to help digest some digestive enzyme to help break down gluten. And she just started again. It just doesn't work.
Those supplements, they're an emergency situation.
Exactly. And then she just went to town on the gluten, got chronically constipated, and then we've retested and it's all come back again. So these are common things.
It's literally just movement through the digestive tract, isn't it?
Yeah.
Everything has to keep moving.
Yeah. Or just going heavy on the process. And it's even things like this, guys. It's like eating out during the day and having things like Tex-Mex things and Mexican bowls. And I understand having it without the wrap just in a bowl is not that bad, but it's the hydrogenated vegetable oils that they're cooking or that meat and stuff in. If you're eating it, that's sort of like fast food chains that are kind of a bit healthy and having healthier options every day, it's not actually good. Just eating more processed foods, just eating more restaurant foods. I mean, I'm not talking some beautiful Italian restaurant or French restaurant with just butter and olive oil. I'm talking about some hydrogenated vegetable oils or going heavy on Asian food with more sugars and, chemicals. It disrupts the pH of the small intestine. And then the SIBO can start to grow back again. So these are just some of the common things. Unfortunately, endometriosis is a major cause of SIBO as well. It causes kinks in the bowel. And I know, ladies, if you've got endo, it's a very challenging condition. And you just, endometriosis is a big gut problem as well because of the way that it gets into the gut. So endometriosis can cause it. These are just the common things. So if, the thing with SIBO, some people need to take antibiotics and low-dose naltrexone as a prokinetic. It's what they need to do for many reasons. Potentially they're extremely underweight, can't do the diet. They're nurses, they're flight attendants, they work on this shift work. They can't do the diet properly. Or they've got massive motility, migrating motor complex issues. People like this, allopathic treatment is warranted, but you really are struggling to get to the root cause when you do that. So that's just a warning. So we just try and work with root cause of getting the SIBO under control.
I think the main message here is don't think that you can come and get this SIBO fixed and then just go back to the way you were. This is a symptom that gets your attention and it's a cue to change some things in your diet, whether that's just as simple as eating 3 meals a day instead of snacking or, reducing the stress. We can't remove all the stress from our lives, but we can reduce it and we can build our resilience to stress through lifestyle measures like exercise and meditation and things like that. But stress, there's nothing that stress doesn't worsen, is there?
No. So what Mel and I all day in our consults are working out where the stress is coming from and what people need to do about it. It's very, very true. So I think SIBO, it's like anything. It's like we can see it as it's just it is a condition and a symptom that your body is telling you that there's something wrong. And you can't ignore it. And it's like a bit of a wake up call and, it's good. It can just be a good reset and you can just sort of improve your lifestyle things that are causing gut problems. And the thing with SIBO, it can make people very, very sick. Very, very sick.
Well, especially long term, you have severe deficiencies that come from it. And
It causes major nutrient deficiencies. Like iron is a big one.
Mhm.
Vitamin B12 is another big one. Folate. So if you've got folate and B12 deficiency, that's a big methylation problem right there.
Mhm.
And then iron, the thing with SIBO, Mel, is like it causes such iron deficiency, and then people go and have iron infusions, especially
Infusion.
women's with the heavy periods. They've just got their ferritin's like 4. The thing with SIBO, it creates biofilm, which is this matrix, like this protective matrix that is created so that the bacteria colonize and thrive under there. And part of the structure of biofilm is iron. So it can create more biofilm, and so it protects these bugs. I often will say to my women when I see low iron, it's like 4, ferritin's like 4 and it's gone to 200. I'm like, oh, did you have an iron infusion? Yes, yes. And straight away I'll ask them how they felt. And if they felt terrible from it, like brain fog, nausea, histamine symptoms, I'm like, we are looking into SIBO. That's one of the classic things. It's like a real hint that it's SIBO.
Yeah, that's one thing about iron that people don't understand is that iron actually, like viruses and bacteria will utilize iron to reproduce. And so sometimes low iron, whether it's SIBO or some sort of an infection, you're just unwell, the body will remove iron from the bloodstream to stop it from happening. So if going and throwing more iron isn't always the answer. That's why we need to look holistically at all of this. You can't just keep throwing iron at it because it's going to worsen the problem if it is SIBO.
Yeah.
Correct the SIBO, then maybe you can start looking at some supplementation and building it back up. But doing it at the same time can be an atomic bomb.
Yeah, especially if you've had massive adverse reactions. It's a really big red flag for SIBO, actually. Yeah.
All right. Well, we've talked about a lot. Is there anything else that we haven't kind of gone through that you think is worth mentioning about SIBO and histamine and the rest of it?
I'll just mention that if anyone suspects they have SIBO, we're here to help. You can book in a consult with us if you'd like to have one-on-one consult. Or I also have my e-bundle. So my e-bundle is on histamine intolerance, and it does go into all the major causes, including SIBO, and how SIBO really drives up histamine, and how FODMAPs and resistant starch drive up histamine. And I've also got in that e-bundle is my SIBO low histamine diet. And we've also got lots of recipes. So you can tackle SIBO on your own if you'd like to. There's also supplement recommendations on what to do about digestive enzymes and getting your bowels moving, etc. So that's all part of my e-bundle, which is available for sale on my website. As I said, we accept patients globally, and if you are struggling with SIBO, then we are here to help.
That bundle is actually great. I've had quite a few people that have come in to see us. They've said, we've done Jo's bundle. I've gotten myself so far. And they just need that little bit of a tweak to find those other layers that are going on. Or like, okay, I've done the SIBO, I realized my hormones are a bit of an issue. Can you help me with my hormones? Or can you help me with mold? Or but they've found it so helpful to get that symptomatic relief. They get the groundwork done.
Yeah.
And that makes it much easier for us because then we can move on to the next thing.
Yeah, I know. And I love when people have done it because they can talk to me they talk my language. Yeah.
Yes.
No, it's good. And also it's good. And also if you are working with a doctor that you love, you've got a good relationship with, and they can help you do testing, it's really well researched. You can say, hey, can you get me these tests done? Or if you are working with a naturopath or nutritionist that you, again, have a really good relationship with, and you're like, they're not histamine specialists, like, again, you can take that to them and you can just tweak some of your protocols pretty easily, I think. So that's what people have told me about the e-bundle. It's available.
It isn't taught to us in our degree at all. We learn about this through the research after the fact. And so not everyone knows and understands histamine. We all have our areas of expertise.
Yeah.
And some people never touch on histamine and aren't really aware. It's becoming more commonly known in our profession, I think. But yeah, the degrees haven't caught up yet with what they're teaching in the colleges.
Guys, I can't believe histamine is so common. It is caused from chronic inflammation, and that's what people have who are seeking help. And so it's everywhere. It's the most common thing, Mel, isn't it? It's just crazy.
They're uncovering more and more about it. I remember reading something somewhere where they're talking about depression and SSRIs being antihistamine in nature, and that's why potentially that could be the mechanism of why it works for some people if their depression is driven by histamine.
Wow, that's fascinating.
We're just learning. It's because it's everywhere in the body, as we know. It's a natural reaction. We're living in a very unnatural world.
Mm-hmm. We are.
Another thing that I might mention is, it's not necessarily a driver, but it can be something that can be helpful for people who've got histamine issues. Another thing that kind of take the edge off is if you've got histamine issues, you may be sensitive to EMF.
Yes.
And
yes. Is that because it just really destroys your cell membranes?
Yeah, it's just because it's just a bit of an irritation on the body. And again, it's the immune system having to respond. And so it's not going to be the be all and end all, but some people will find, if I don't have my mobile phone in my bedroom overnight, some of them have their modem in their bedroom or on the wall behind their bed, simple things like moving that can reduce the symptoms. It's not the cause, but it's another solution that can help take the edge off. And again, that is something I would take moving forward. You can't avoid EMF, but you can certainly minimize it. And the best way to minimize EMF is distance. There's lots of gimmicky things you can purchase for EMF, but by far the greatest impact is the distance.
Yeah, and it's not that hard to do. That's not that hard to do. No,
it's not.
Yeah. Right, Mel, thank you. That was great. I really appreciate your time. So thank you so much.
That was awesome. I think we covered a lot. I hope everyone enjoys the episode.
Thanks, Mel.
Thanks.
So thank you for joining me. I hope you found this episode beneficial. Be sure to subscribe to the Histamine Well so you don't miss an episode. Leave a review, and you can also share this episode with someone who could benefit. If you have any questions you'd like answered or have a topic you'd like me to discuss, please go to my website, joannekennedynaturopathy.com, where you can provide us with that information. Until next time, take care and be well.